Okay. Hey guys, welcome back. Latoya Holistics by For Everybody. Glutathione. Okay, let's talk about this one. This is an antioxidant. Okay, it is an antioxidant that we produce in the body. But as we get older, I would say towards like your late 20s, early 30s, and 40s, depending on your nutrition and how you've been eating, we tend to stop or we tend to decrease the amount of glutathione we make in our body. It is an antioxidant. Antioxidants have a tendency, or actually have this superpower, is what I would want to say, of disrupting the production of and also destroying cancer cells. Okay, there are food sources for glutathione. I will list that below. However, I have the IV form. You can take it IV or IM, which is intramuscularly, where you get an injection. We use a precursor to this in the hospital. If you're in medicine or in nursing, you will recognize this name as Mucomyst or acetylcysteine. Okay, it's a precursor. In the hospital, what do we use Mucomyst for? Use it for, number one, as an inhaler. So if somebody has some type of a pulmonary condition or respiratory condition where they have a buildup of mucus, very thick mucus, they can't breathe, typically in like COPD, emphysema, bronchiectasis, especially pulmonary conditions that the person may suffer from extreme low oxygen levels, and they can't get mucus up. There's a lot of mucus and congestion in their lungs. Okay, so we actually use Mucomyst as an inhaler in the hospital to break that mucus up and help the patient expel it. Especially, we kind of run to this medication when we failed at getting them off a ventilator. It usually works wonders. Okay, the other time that you will see it used as acetylcysteine is for preparation before a CAT scan. So when you have an IV contrast CAT scan, you run the risk of going into kidney failure because the IV contrast can be damaging to the kidneys. When someone is dehydrated, has suffered from some type of kidney injury because of dehydration or sepsis, like an overwhelming infection, or they just may have chronic kidney issues, we tend to pre-medicate them with the precursor to this glutathione, like I said, which is Mucomyst. Okay, so we use that as a protective mechanism so that the person does not suffer any more damage to the kidneys. We're trying to preserve the kidney, okay? And it actually does help the patient with their outcomes. So now the third way that we're using glutathione, precursor, acetylcysteine, Mucomyst in the hospital. We have a suicidal patient. This suicidal patient does not know that by taking Tylenol, it's not going to kill them. They can overdose on Tylenol, it's not going to kill them. They can actually die, okay, but it's a slow and painful death from liver failure. Okay, so this is where we step in now, and we use the same acetylcysteine or Mucomyst on these patients. We use it to protect the liver because we're trying to prevent the liver failure that's going to be impending on this person. Poison control is very involved with this. They track this patient, we track their liver enzymes, we track their blood counts, we track their coagulation studies. So anyway, that is the third way that we use this medication. I've been using this on myself, on my patients, also for just rejuvenation. If you have gone through the virus, this is something to consider. All right, especially to promote rejuvenation. It actually does increase your energy. Okay, for number one, it does rejuvenate liver, kidneys, and lungs, and skin, to say the least. I feel like it has a good overall effect on the body in general. So that was my little tidbit on glutathione. It's one of my favorite drugs that I keep here in the clinic. It tends to run out. So guys, thank you so much for watching. Take care. Peace out.